Suds Enema, scan the room. You're going to start by showing up in the College of Nursing uniform. I would begin by checking the medical order form and hospital policy. I'm going to identify the patient. I have Mr. Jaguar Jones. His date of birth is 8/25/1963, 8/25/1963. And next I would assess for any allergies. It says here, is he allergic to penicillin? I would check with the patient to make sure there are no other allergies that are not listed. And next I would explain the procedure to Mr. Jones. Mr. Jones, today I'm going to be doing a Suds Enema. You can let the patient know that there may be some discomfort, but if there's any pain, to alert you. Next, I would perform hand hygiene and prepare my Suds Enema bag. I've already done so. So I have my Suds Enema bag with 750 to 1,000 milliliters of water or saline, and I've already put in my soap solution and just mixed the bag and have it hanging on a makeshift IV pole. Since this is already complete, normally I would come back, perform hand hygiene, and don goggles. Next, I'm going to don clean gloves. Now that I have on clean gloves, I'm going to raise the bed to a comfortable working height and lower a side rail. At this point, I would assist the patient into left lateral stems, so I'm going to simplify this by moving the patient's leg. And now the buttocks would be facing me. At this point, I will take a waterproof pad and place the patient's hip under the buttocks. And I would open my water-soluble lubricant and place it on the waterproof pad. Now I'm going to take the tubing for the enema bag in my dominant hand and remove the cap. At this point, I'm going to lubricate the enema tube. I'm going to lubricate 3 to 4 inches. I would put my non-dominant hand on the patient's hip and let them know that they need to take long, deep breaths during this procedure. I'm now going to spread the buttocks with my non-dominant hand and insert the enema tubing with my dominant hand 3 to 4 inches. Once inserted, I will unclamp the tubing, remove the bag from the IV pole, and hold 12 to 18 inches above the patient. If the patient were to complain of cramping, you can lower the bag to help with that. And I would allow time for the entirety of the bag to float into the patient. Once this is completed, I will remove the enema tube. And I'm going to place mine back on my makeshift IV pole. Now the patient needs to remain on their side or in left lateral stems for 10 to 15 minutes or until they are ready to evacuate. So at this point, you would just allow them to sit. During this time, a nurse could do other things in the room, so this may require them to take off the clean gloves, and then when they come back, put on another set of clean gloves. For time's sake, I'm going to move on. At this point, I would allow the patient to evacuate by placing a bedpan under them. So now that I am doing this, they will be laying on their back, and I'm going to move my patient's leg to signify that. When they're evacuating, it is okay to give them a little bit of privacy to cover them back up. They are laying on their back now. And if they are having any trouble, sometimes it is helpful to raise the head of the bed to give them a little bit more comfort. Once the patient has finished voiding or evacuating, I would remove the bedpan, cover it with a towel, and set to the side. At this point, I would perform pericare to clean up. I would remove this waterproof pad and replace it with another. And assist the patient into a comfortable position. At this point, if my gloves are visibly soiled before assisting the patient, I would want to put on clean gloves, but mine are okay, so I would assist the patient to a comfortable position, cover them up, allow them some privacy. And now I would lower the bed completely to the lowest setting and raise back up that side rail. I would then take my bedpan to the bathroom and dispose of anything in it and clean it out. When I come back out, I'm going to remove my clean gloves and again assess the patient for comfort and make sure they have anything they could need within reaching distance, so their call light or anything like that. If the patient is comfortable, I can now move on to documentation. In documentation, I'm going to list the type and amount of enema. So I had 750 to 1,000 milliliters of a Suds Enema. I would also document the time, patient tolerance, how the patient was left, and the color and amount of any return. And that completes the Suds Enema.